The military operational medicine research program reported an incidence of stress fractures for male army recruits to be 2.6% and female recruits to be 8%. Israeli military in 1985 stated in a prospective study of 295 male military recruits that the incidence of stress fractures to be 31%. In Pakistan Military Academy, they looked at their cadets on the basis of records available in the Institute of Nuclear Medicine, Oncology and Radiotherapy at Abbottabad. And they found an incidence of 68%. Now, nuclear medicine or isotope scanning is much more reliable in the diagnosis of fractures as hotspots. And we do not have facilities to use isotope scanning in the diagnosis of fractures in our country. It's limited to very few hospitals. And most of the fractures there were labeled as grade 1. And high grade fractures were confined to tibia, and tibia was the commonest site of stress fractures. And then that accounted for 73% of all fractures. Indian military did a very large study over 5 years, 12,700 recruits from a single military training center, and their incidence was 11.4%. Again, the commonest site was tibia, and the overall rate of return to active training was 91% at 12 weeks, so it takes a long time, and 99% at 6 months, 24 weeks. Cadet officers enlisted to military enters a new environment in which they face both physical and mental challenges. The first phase of the induction into military include basic combat training with basic soldiering skills, army values, military customs and courtesy, and other information critical to the transformation of civilian to the soldier. All phases of BCT include a wide variety of physical tasks, field exercises, motor skills training, and physical training involving running and marching. These physical tasks put recruits at risk of injury, now a concern of most BCT commanders. Identifying modifiable risk factors for injury and the development of successful prevention strategies are important in injury reduction interventions. In the injury prevention process, surveillance and service is critical to determine the size of the injury problem. So in conclusion, incidence of stress fractures is 8% at KDU, and I think we need to do further research in collaboration with other military academies, which would be useful to identify the size and the disease burden. And I've been told informally that military academy or the Sri Lanka Air Force has less stress fractures after modifying their training surfaces and giving better boots and so on. So at KDU, we did introduce a new shoe, and modification of training surfaces are done as a preventive measure. But I think a prospective study to find out the ultimate outcome is a requisite. Thank you.
Once again, the opportunity available to the audience to ask your questions, please.
Good afternoon, sir. I'm the Commandant of the Naval and Maritime Academy. I would like to clarify 2 or 3 aspects of your research. One, of course, I think the solution regarding the shoe. Now, has the design shoe shown any positive results or?
Not yet, because we have just introducing it now, so we don't know.
And did your research?
But even this year we actually have one cadet, medical cadet who has bilateral linear fractures of the tibia, who required more rest. So.
And did your research also include, did you all go to the extent of finding whether the stress factors occur when they do a road run or on the ground, or, does it depend on the terrain?
No, we only recruited cadets who presented with limb pain after having gone through training, and normally they came during the intensive period of training. As soon as they are recruited into military within the first 3 months. That's the time we started picking up the problem.
So I suppose they do the training both on the road as well as the ground.
Yes.
Thank you, sir.
Okay, since
Sir, can I ask a question from the command? Do you see stress fractures in your military academy? High percentage or numbers wise?
anyone else? Okay, one last question.
Good afternoon, sir. Major Ajit Veliman. I would like to point a question at you. Now you told us the medical analysis of the tibia and the stress fractures. Now when it comes to training of a soldier, usually the military drag him to the utmost level of physical and psychological barriers, where they've been, trained to withhold the pain or bear the pain, bear the mental stress. So now, what is your opinion in balancing this medical casualty which you have indicated and amending the training according to the required situation? What is your advice on that?
Let me be clear on one thing. I am not a person who wants to compromise military training. That's one. Two, however, we have two problems. We recruit cadets on our own criteria, which we think are the best criteria for selection into military training. So we select people who have done fair amount of sports activities. So that aspect we need to look at very carefully to see whether we are really taking the right people in, because they have gone through PT test and all that when they come in. Then secondly, when you induct them into training during the intensive period, are we really going at 10% increases at every week on exercise regimen? Now I think on the other side, early this morning, there was a paper from Colonel Makulolu on pain, degenerative changes on the spine after long periods of training, where she said we clearly attributed that to overuse, especially during training and especially in other ranks. So, and in fact, some of the non-military members who present in the audience said you might have to observe what instructors do to see whether they actually overdo things in their training. If they are overdoing, it might be harmful, because sometimes one of these, at least we know one cadet last year left the KDU due to complications of a stress fracture. He went in to develop infections, osteomyelitis, septic arthritis, went on for 1.5 years and ultimately left. So I really don't want anybody to leave the military academy after recruitment of training. So don't compromise on training and the standards. But let's see whether we are overdoing things. And we really want them to tolerate pain, but let's train them to tolerate pain slowly, not excessively from the beginning, with gradual increases of training. Because we certainly will be losing money, invested money, if we really start losing a lot of cadets due to stress fractures and their complications.
Thank you, sir.
One more thing, I do want to see them malingering, but I think out of 175 cadets, only 19 presented. So 156 didn't present with pain. Actually, if the malingering was a big problem, a larger number of cadets would have presented. And certainly, our MI room doesn't permit that we would recognize such problems very quickly. But I think if we had used isotope scanning, probably all 19 would have been diagnosed to have stress fractures.
Thank you very much, Professor Sujeewa. Please join me in showing our appreciation to him.